Hello, I'm the Education Coordinator for the Northern New England Poison Center. In this presentation, I'm going to discuss e-cigarettes and facts about nicotine. Our objectives for this discussion are to review the properties of nicotine and identify both traditional and newer methods of delivery. I will be describing the side effects of nicotine associated with poisoning and overdose and reviewing some resources for information and prevention strategies. Nicotine is a naturally occurring stimulant derived from tobacco plants. It is most often chewed or smoked, and habitual users claim it has a relaxant effect, increasing alertness, focus, and metabolism. It is highly addictive. Its only medical use is to treat nicotine addiction. As a result, nicotine replacement products have been developed, including gum, lozenges, patches, and nasal sprays. Tobacco has been used as a smoking product for centuries, traditionally as a cigar or cigarette, via a pipe, or as chewing tobacco. These images are what most people think of when they think of nicotine delivery devices. An 8-year-old girl found what she thought was gum on her father's bureau and brought it to school. She shared it with a friend at recess. Approximately half an hour later, one of the two girls vomited and was taken to the nurse's office. The other child said she felt sick and also went to the nurse's office. Both complained of nausea, had increased heart rates, and were agitated. The girl who had vomited soon began to feel better. The other girl, who had not vomited, remained nauseous and agitated and soon became sweaty, pale, and lethargic. An ambulance was called to transport her to the emergency department. En route to the hospital, the child vomited and upon arrival was already feeling better. Investigation revealed that the gum the child had brought to school was nicotine gum, which contains 2 to 4 milligrams of nicotine per piece. Many medications look similar to their harmless doubles, especially to children. Just as with any other medication or substance of abuse, these products should be stored out of reach of children. A child who has ingested nicotine may appear hyperactive and agitated initially, but could have problems breathing or become unconscious. A 19-year-old male calls complaining of jitters, sweating, nausea, and a dry mouth. He states he was using an electronic cigarette for the first time today and had it on the highest setting. The poison specialist explains that these symptoms are consistent with getting too much nicotine and will eventually resolve on their own. The specialist recommends that he lower the dosage on the e-cigarette to avoid getting too much nicotine in the future. Other symptoms include anxiety, weakness, tachycardia, and vomiting. Even when properly used, e-cigarettes can cause nicotine poisoning. Many factors influence the effect of nicotine on the body. As you can see, the range of concentrations vary widely, with the liquid nicotine refill products having the highest total amount of nicotine available. The amount of nicotine a person extracts from a traditional cigarette depends on how it is smoked, quickly versus slowly, long drags versus short puffs, etc., as well as the type of cigarette, filtered versus unfiltered. It also depends on the person's metabolism and tolerance to nicotine. Liquid nicotine, because of its concentration and the ease with which it enters the bloodstream through skin contact, is particularly toxic. Disposable e-cigarettes and e-hookahs are fairly inexpensive and readily available at the local Quick Stop, right next to the Slim Jims and 5-Hour Energy drinks. They're not kept behind the counter with the other smoking products. They may be marked not for sale to minors, but are clearly marketed toward teens and young adults with their candy and fruity flavors like Crazy Apple, Bubblegum, and Strawberry Margarita. Rechargeable e-cigarettes are usually sold in smoke shops or are kept behind the counter. They range in price and style and require liquid nicotine refills. Doesn't this look like a pen? It's a disposable e-hookah offering approximately 800 puffs in crazy apple flavor. These hang on a counter display and cost $7.99 at the gas station convenience store. Here is a rechargeable e-cigarette. As you can see, it's a little more complicated than the disposable device, requiring the user to refill the reservoir with liquid nicotine solution. These are also used for smoking hash oil, cannabinoid resin, which introduces additional hazards due to the chemical content, THC, and flammability. This is a display of liquid nicotine refills in a variety of flavors: strawberry cheesecake, peppermint twist, and concentrations. Higher concentrations and larger bottles are available online. As a smoking cessation device, the idea is one would start with a higher concentration and gradually reduce to 0 milligrams of nicotine as they wean themselves off of their nicotine addiction. There is no evidence that this is an effective means of quitting smoking. It is a novel and trendy way to initiate a nicotine addiction, however. This is particularly true for adolescents and young adults who have the mistaken perception that this is a low-risk form of smoking because it does not contain all of the other hazardous ingredients in traditional cigarettes. Nausea, vomiting, headache, and agitation are signs of toxicity and may occur during normal use in new users. There may be a slight delay in the onset of these symptoms, allowing users to overuse before they realize there is a problem. Less commonly, users may experience an increased or irregular pulse, skin irritation, or an allergic reaction to one of the ingredients. As I've said, toxicity depends on a variety of factors, including age, weight, tolerance, and other health issues, as well as the type of product or device used. Adults have survived much higher doses than 40 to 60 milligrams. Here are some signs and symptoms to look for that might indicate possible nicotine exposure. In children, hyperactivity and anxiety can be followed by difficulty breathing, which should be treated as a true emergency. Treatment depends on the degree of exposure and the other factors I've mentioned. Vomiting is likely, although it should not be induced. Respiratory and cardiac symptoms should be treated as a true emergency and will require management in a hospital setting. When in doubt, call the Poison Center for a consult. Call center staff can connect you with 911 if necessary. Here are photos of another electronic delivery device. Ingredients: propylene glycol, glycerin, natural and artificial flavors, may contain nicotine. This is a bottle of liquid nicotine. There is no information yet on the short or long-term health consequences of inhaling these substances as a vapor. The bottom line is we just don't know the health effects of frequently using this product. Here's a 10 milliliter refill bottle. At 18 milligram concentration, it holds 180 milligrams of nicotine. At 24 milligrams concentration, that's 240 milligrams of nicotine. Bottles are made of glass or plastic and have a press-down or twist-off cap, revealing a slender spout underneath. Not child or pet resistant, and containing tempting flavors and smells. As you can see, the number of calls received by poison centers for e-cigarette and liquid nicotine poisoning are on the rise, with young children the frequent victims. 2014 saw the first death of a child due to liquid nicotine poisoning. This is a display in a smoke shop. You can see the variety of refills as well as some different devices in the back, from the inexpensive to the elegant, complete with zippered case and tiny stainless steel funnel. Although these products have enough nicotine in them to cause a serious problem, most exposures have had minor to moderate health effects, not life-threatening. Many northern New England Poison Center cases have involved teenagers and adults who experience mild to moderate nicotine toxicity due to excessive use of e-cigarettes. E-cigarettes and their refill bottles pose a much more serious threat to small children and pets. In addition to being a 24/7, toll-free, HIPAA-compliant resource in a poisoning emergency, the Northern New England Poison Center is a great place to turn when you have a question about a new substance or trend, or if you need information to share with faculty, students, parents, coworkers. On our website, you can find an A to Z file for common poison subjects, blogs by our own toxicologists and other experts in the field, and education and prevention material that you can order or download. Each state has an education coordinator who can guide you to appropriate materials, provide presentations for your group, and direct you to other prevention resources in your community. We welcome your feedback. To give feedback about this training, please go to this site for a brief survey. Instructions to obtain a training certificate are at the end of the survey. Thank you.